Hello, my name is Mauro Lindao and I'm going to talk about osteogenesis imperfecta. Osteogenesis imperfecta is a pathology from the bones. It's a genetic pathology that causes a bone break of the bones because of several trauma or a disorder of the bones that break easily. This kind of pathology is properly from the kids. As I said before, it's a genetic disorder that it is characterized by having bones that break incredibly easily for the seemingly not apparent reason. Which are the symptoms? But before to see the symptoms, we have to see the video that involves this pathology. This pathology involves this video that I have here. It's a person who suffered this disease. This girl has the pathology from 2 years, from when she was 2 years old, from now. As you can see, this girl has not all of the symptoms, but she expresses all the suffering and some kinds of things that she has suffered in this pathology during all this time. Yes. Okay. So we can see here also the bone in the back that can cause a spinal curvature called phosis, which has a lid on the humpback. This is the classic manifestation of the symptom of this pathology. The treatment, it has no cure, but it involves only managed and vital support. Okay, a person who have osteogenesis imperfecta may experience a few fractures, while those, and these with the several forms, may have hundreds in a lifetime. So this is a very severe disease that we have to treat and we have to see. In this video that we have here is a child of 10 years old called Natalie, that she has suffered osteogenesis imperfecta since she was 1 year in his life. But as you can see here, she tries to have a normal life, and she's with specialized people like traumatologists and internal medicine. Also, the first signs of osteogenesis imperfecta are bone fracture that occur with little or no trauma. That's the reason why these kind of patients are called the glass or the baby glass, because their bones break easily. Here we can see the form of bones, and as we can see, they are not symmetrical, and also these bones are not in the correct direction. Okay? Which are the causes? The osteogenesis imperfecta is a congenital disease, meaning it is present at birth. It is frequently caused by a defect in the gene that produces type 1 collagen, and it's an important building block of bones. There are many different types that can affect this gene. The severity of osteogenesis imperfecta depends from the specific gene defect. Also here we can see most of the osteogenesis imperfecta are unright from parent, although some cases are the result of a new genetic mutation. A person with osteogenesis imperfecta has a 50% of chance of living in all his life. Okay? Here we can see a video that shows to us how is the testimony of this guy that has osteogenesis imperfecta. It's called Renidine. As you can see, it's a very difficult pathology, and supporting with them, and it's very. They have to take very careful about all the year of his life. Also, we can see here all the environment that she's around and the personal experience about this disease. As you can see here, look at the guy of the left, and you can see the bones that are deformed and that are not symmetrical, and they are not in the correct way as a normal person have. Also, it's very important to know some tips, because osteogenesis imperfecta is not contagious. Also, it's from one person to another, but it has to be it's about genes, so it's about genetics, not it's a virus or about infectious disease. Also, it has not cure, because the only treatment for this pathology is the supporting vital signs, and also to prevent the break of the bones. Okay? This is a different type of view of osteogenesis imperfecta from a scientific view. In this video, you can see all the development of the disease. Also, you can see where is the disorder. You can see there the lost triplet helix in the gene, and that's the reason why this pathology produces. The third piece will be phosphonados, the long pack exercise. Okay. Also, the different types. This type 1 that affects osteogenesis imperfecta, made to the teeth or making prone to the cavities or cracking. Also, type 2. The type 2 osteogenesis imperfecta is the most severe from the disease. Also, type 3. Type 3 osteogenesis imperfecta also has improperly formed collagen. Type 4 osteogenesis imperfecta is moderately severe with improperly formed collagen. How common is this disease? It's around 4 to 5 per 100 people. So the prevalence is not high, but it's not a little prevalence of this pathology. In this video, you can see another child that suffered this pathology and tell us its or his testimony. Okay? Thank you very much, and this is all about osteogenesis imperfecta.